Main menu. If you have a 29-year-old patient whose sole cardiac risk factor is that they walked into the ER complaining of chest pain, and you would like them admitted for a rule-out, please press 3. You have selected Cover Your Ass Medicine. If the patient had a negative stress test in the last 3 months, press 1. There will be a long pause during which you should ponder your decision. If the chest pain has been going on for 3 or more days, also press 1. If the patient states the pain is just like their reflux and got better after they took Tums, press 1 repeatedly and remain on the line while we verify that you received your medical degree from an accredited institution. If the patient states that their pain feels like someone punched them in the chest and someone actually punched them in the chest, press 2. We will come down and punch you in the chest. If you just intend on blaming the admission on your attending, press 3. To return to the main menu, press pound. Main menu. If you are an ER resident who, quote, just took over several patients and have no idea what the story is or their diagnosis, but the previous resident said to admit them, please press 4. Someone will be down to do your job for you shortly. If you have a patient that had non-specific complaints resulting in them getting at least 3 doses of IV contrast while they were pan-scanned before realizing that they had chronic renal insufficiency and a baseline creatinine of 2.8, and now need to be admitted for hydration, please press 5. The noise you hear is the sound of the MAR beating their head against the counter. If you have a patient in need of a Narcan drip in the RICU due to frequent dilaudid doses in the ER, press 6. You have selected intubation iatrogenia. If the patient is still complaining of pain despite being barely arousable and you are contemplating giving another dose, please press 1 and wait for your DEA number to be revoked. If the reason for the pain was actually constipation from the massive home doses of narcotics, please press 2. We will then defer admission until you make the patient go number 2. To return to the main menu, press pound.